Well, good morning, everyone, and thank you for being here today. This is a really big day for me to be able to share 5 years of incredible work that all of you have performed at this university. So this is a great story. You're going to hear me say a lot and realize that this is abridged. There are so many things that I could not include because of time constraints, but I want to cover the ones that I thought were most important for this group to be able to hear. Before we talk about what we've accomplished in the last 5.5 years together, I would like to start with a little picture of where we were. It gives you a little bit of context of where this university has come because of the great work that all of you are doing, compared to where we were back in November of 2019. So this university, this is some work that was being done in the picture above us where a new building was going up. And while that looked like there was some activity and construction taking place on this campus, the reality is we had some challenges that we needed to overcome. So looking at where we were financially, and I know we're not here to make money, but money drives what we do. It pays for salaries, it pays for refurbishment, it pays for growth of programs. Our reserves were depleting year over year. Our bond rating had been dropped by our bond agency, Moody's, to Baa2, which is just barely above junk bond status. We had increased debt, substantial increased debt, and the Higher Learning Commission does a composite index on us that says how healthy are we, or are we at concern that we are not going to be financially stable. Anything below 0 is really bad. It goes from -4 to +10, and we were a -1. Unfortunately, the Board of Trustees didn't even know we were -1 because we learned about it later on that we had misreported data that made it look like we weren't quite as low as we actually were. We had a health insurance crisis that hit us in November of 2019. We were told by our self-insured group that we likely had $6 million in expenses that we weren't planning for. For us, that is a huge amount of money. And we had a university pharmacy that had been built on this campus under the Rootstown moniker that had expended over $2 million, but it was losing well over $200,000 a year operating itself. The College of Medicine, as many of you will remember, was in trouble. LCME noted numerous deficiencies and findings. We had poor student satisfaction, and they issued a warning of probation that we had to overcome nearly immediately. We had existing partnerships that were costly and not mission aligned, meaning we were paying out dollars for things that really had nothing to do with higher education at the time, and they were large sums of money. The previous president decided to have a survey done on our faculty, a faculty retention survey. And the results of that survey came out in my first month here at the university, and it noted that there was an all-time low morale of our faculty. Now, this is our faculty speaking. Faculty distrust of senior leadership was a common theme, and it was at the level of the dean all the way up to the president's office. There was a notable lack in faculty development and faculty recognition, that the university didn't support research endeavors, but at the same time, we heard the educators saying, you don't support education, and instead you put a premium on research. We had large amounts in the multi-millions of dollars of non-mission aligned funding, and faculty and staff salaries were noted to be low, with years going without an annual increase to pay. We had unsafe and deteriorated anatomy laboratory that had been called out. We had outdated HVAC systems, outdated and failing chillers, multiple buildings with leaking roofs, and outdated and inadequate IT systems, something we heard a lot about near the end of 2019. And so this university was in a position where we were in a very tough place. And then we were hit with a global pandemic. Virtual working from home, skyrocketing inflation, and mid-year significant cuts to our budgeting by the state of Ohio at a time when we most needed that money in order to turn around. There was a demand at the time across this country for returning tuition and fees. And higher education since then has had a value crisis. And we've been called out, many, in fact, the majority of Americans saying they don't know that the value of higher education is worth it. So we were able to come together as a team. I think many of you remember these days when we said we're going to develop a strategic plan that was going to be our roadmap for the future. It was going to outline where our priorities were, and those are areas where our resources were going to be expended. And if it wasn't part of our strategic plan, it wasn't going to be part of where we spent money. We really came together in an amazing way doing this. Thousands of inputs from all of you, from our community and our clinical partners came together to help shape that strategic plan. And it was approved by our Board of Trustees in September of 2020. So 5-year plan would essentially culminate in about this time right now. What I'm going to share with you is what we have done together. We've done an amazing set of things, and there's so much to share with you that I hope this isn't too overwhelming. But this is all of your work. So infrastructure, our buildings that we have on this campus, we have to maintain them. If not, we're constantly running debt for something called deferred maintenance, meaning you're letting it go, it's going to break, and then eventually the straw that broke the camel's back means we can't operate. We don't have chillers that work. We don't have an HVAC system that work. Our buildings become condemned because we are not maintaining them and fixing them. That became a critical part of our strategic plan. Well, you may remember during the pandemic in 2020, we opened up this brand new building on campus. A beautiful building, 100,000 square feet had been planned several years before. The challenge was it didn't have a business plan, meaning it had debt that was going to be on it. And while the top 2 floors were paid for by the state of Ohio for Biomed Academy, the bottom 2 floors that we had debt on didn't have a way to cover those costs. So we were able to come together and put the Wasson Center there and be able to reinvent the Wasson Center in a way over time that made it sustainable and made it make sense. We built out NEOMED Healthcare, and this became the home to NEOMED Healthcare, and it pays rent to be in that building. Summa Healthcare negotiated a deal where they came out in really fitting for a health sciences campus. We have an urgent care facility and 9 subspecialty clinics, and they became part of our business plan in paying for that building so that we not only have healthcare, but we have somebody paying the rent on that building. And so we're actually in a very good spot with that building now. Other infrastructure improvements, many of you who've been here a long time remember the Nook, a really tiny, overcrowded bookstore, to use a typical term for it here on our campus, that was having a hard time being accessed by most people who would want to get to it because it was so hidden. So we decided to make it bigger, more powerful, make it one of our rent-paying organizations, because it is separate, it is a taxable income at the university in the new center area. And we heard a lot of concerns about our former coffee vendor. And so in response to you, we built in Starbucks at this university with improvements in food services that would be available. We also built a military lounge to become part of the Purple Star Collegiate Group here in the state of Ohio, but building out something that represents what Ohio and the Midwest often represents, and that is patriotism and recognizing the need to support our military-connected members. I think all of you at this time have had a chance to see the major revamps we've done, the student study spaces, the student gaming lounges, the Timken Medic Center that the Timken Foundation came in and helped us to offset the costs and build. In 2020, we opened up the Great Hall, this really high-tech educational space, allowing NEOMED to be one of about 4 medical schools in the country that has adopted pure instruction as part of what we do in the fabric of who we are. We've upgraded the IT within this hall that had significant issues, and as you can see on the image to my right, your left, that we went through and started revamping this entire campus from end to end. We are not there yet, but we have made substantial progress to improving the infrastructure of this campus. Those of you who migrated through the South Corridor up until a few years ago would have noted it was pretty dingy and dark and a little bit beat up. Well, that has become a shining, glowing, colorful, vibrant place. We allowed the students to pick the color, and so really well representative of who we are. RGE fourth floor was completed, which is really a state-of-the-art research and educational space for us. And of course, we just had the groundbreaking for the Batante College of Dentistry and the absolutely amazing facilities that we have opened up there. In total, for the past 5 years, we've managed to invest $46 million into facility improvements so that this campus can be vibrant, it can be reflective of who we are, and a vibrant campus is a vibrant place to work, and it's reflective of you and not something that looks like it's run down and is deteriorated. We also, most importantly, focused on our people, all of you in the room, all of our students, because our people allow us to do what we do. We don't make car parts, we deliver service. Research and education are our mainstays. For our faculty, we developed the Faculty Empowerment Plan, and I'm going to show you in a minute the impact that that has had at this institution in addressing some of the concerns from the faculty survey. A faculty workload policy, something we were by law supposed to have since about 2014, but didn't. And it turns out now I think you can see the value of it because it guarantees faculty's research element with pay, that it's not dependent on them having external funding in order to be able to pursue their research pursuits. A post-tenure review policy so that we can work with faculty, ensure they're hitting the milestones that they need to be successful, identifying them early and building out resources to help them be successful. The annual performance review, which feeds into that so that we're working together, as most people do, to say, are you meeting the achievements for your success and for university success? And then we activated a new faculty information system that's still, I realize, being adopted in its early stages, but it's a very, very powerful tool for us. So I want to explain the Faculty Empowerment Plan. There was a lot of concern when it was first developed. If you look at where we were, the blue bars represent real dollars. The red bar represents double AMC, which is our national benchmark, 50th percentile. But you remember, 50th percentile is reflective of a nation. In San Francisco, the cost of living index may be a 3, whereas in some parts of Arkansas, it might be a 0.6. So in Ohio, it's ranged between about a 0.82 and about a 0.9. That means a dollar here is worth more than 3 times the dollar's worth in San Francisco. So what we did is we took our geographic cost of living index and multiplied it to come up with what your dollar is worth here. And you can see when you do that, the green bar, when the Faculty Empowerment Plan was fully in place for assistant professors, we are now paying substantially more than the double AMC average relative to our geography. For our associate professors, the same thing happened. And you can see prior to that we were underpaying. Our faculty were correct. Now, these are averages. Certainly, an associate professor in year 1 is going to be different than an associate professor in year 7. And there is a performance element to this. And our full faculty were delayed at their request, but we brought them in fully in fiscal year 25, and that brought them to just about parity with our national partners. So I think this is a great story to say this plan is working. The great part about it is it's automatic. You don't have to rely on the university to say, well, what are we going to do for raises? It's automatically calculated in based on what's happening nationally. The other good part of it is it's blind. It doesn't care what your race or your gender or whatever other elements define you. It's all objective and numerical, so we don't run into challenges with parity in pay. We also instituted the Institute for Teaching Excellence, which is growing and being utilized in the provost's office. We empowered our university faculty council. In 2019, I was told by senior chairs of departments that it was really where the junior faculty went and made decisions that were perhaps not as critical. Now it's become the voice of the faculty. It's part of our fabric of shared governance. And to make sure that that was really powerful, we created a position on the executive management team for a representative UFC, so there is no filter in our communications. You hear it directly as it's being spoken. There are no other secret meetings that take place. And then we get to hear directly from the University Faculty Council what's important to them and be able to address it. We did create a suite of development resources, some of those used more than others for our faculty, decided to do more recognition with the President's Excellence Award, and then we created a writing center, which is used very heavily by our faculty for grants and for peer-reviewed publications. We partnered with university hospitals to create the UH Faculty Scholars, or UH NEOMED Faculty Scholars. We pick 30 annually, which is about half of our core faculty on this campus. They all get recognition, but they also receive $10,000 each that they can use either for academic pursuits or use for salary support. And while you can't guarantee it's a reflection, I think that faculty see their pay as appropriate now because over 80% do not use this for their paycheck. They use this for their research and their academic pursuits. And it's led to an enhancement in collaboration. The other thing this does is UH gives us funds outside of those $10,000 to generally support the cost of faculty on this campus to educate our students. For our staff, we hired Milliman to come in and evaluate how we were paying. What we learned was with most areas we were fine. There were actually 1 or 2% where they said we were overpaying, and of course we left those alone, and about another 8 to 10% where they said you need to bring these up to market rate. So we did. We also realigned the classification system and introduced an incentive bonus plan at this university where if you chose to, you could do additional things that the university would like you to do for growth. That could also affect your ability later on to pursue other pursuits, such as other positions either here or somewhere else, such as Lean Six Sigma Green Belt and Yellow Belt, which carry a lot of weight. Typically, a Green Belt can command a much higher salary someplace than somebody without that level of training, and we give it to you at no cost. We also committed to annual salary increases, and I can tell you that those annual salary increases have been significantly higher than any of our peer institutions in the state of Ohio. And in fact, this year, we were in a good enough spot that the really high achievers on the performance systems received a 5% increase in pay in addition to receiving the incentive bonus they may have pursued. Since these last 5 years have gone by, we've increased staff salary by 22%. We've already taken out deans and senior leaders out of this, so this is the core individuals at this university. We created the Employee Empowered Excellence Program to give you educational tools you needed to be successful in your work, and these have been embraced with over 95% positive responses and the classes filling up. We created a President's Excellence Award for our staff and a variable work hour policy that said we get life can be tough. And so if you have family issues or something you need to do, if you want to come in late and leave late, or come in early and leave early, or choose to come in early or late and take a 2-hour lunch, that we could accommodate you for things that happen in life so that you could have that variable opportunity. We created a remote work policy during the pandemic, and then we've maintained it, allowing employees up to 2 full days of working distance. We've added more staff positions because there were areas we were understaffed, so we've invested. Year over year, our budgets have gone up for every single college and department at this university because we've been able to do so. And we've worked on improved communication channels, including university updates, where I get up and share with you and then take the heat with questions every month. But the Pulse and other areas at this university have been focusing on communication. Communication can always be better. It is a challenge at every organization, but I think we're making progress. For our students, we wanted to give them more than just the success of their academics. We wanted this to be a great place for them. We decided to adopt a really high bar. It's the Net Promoter Score. It's what companies use to decide whether you're great like Disney or you're marginal or you're just not very good. And the question is not, are you satisfied with what we're doing, but would you recommend us to your friends and family? And that's a big poll because your own reputation's on the line. And if you look at where we were early on, it was in the negative range. And this range goes from minus 100 to plus 100. Our last measurement was for 2024. We still need the one to come out from this past year. But you can see anything above 1 is considered good. And we are now in the positive range, and we weren't in the past. I'm sure there was a pandemic effect to part of this, but we are continuing to track this, and it's a high bar for us. Created the Center for Learning Excellence. We also put a student position on EMT so students can get unfiltered information, and then they can take it back and bring their concerns to us. And the Writing Center, of course, benefits them. We've also created NEOMED Connect to enhance mentoring. It was something they really wanted. This is a great program we've been using with over 500 mentors who've joined the pool of individual students can benefit from. We opened up a student healthcare services program, NEOMED Healthcare. It was something that was noted we did not have in that LCME review where we were at warning of probation. We've expanded study space and expanded wellness resources, all because this is what they said they wanted. And we took our mental health program and put it in a more professional setting and professionalized its access so that it is being utilized at an increased rate and it is available to our students. Right now, they're getting 6 per semester, free visits, which means 18 per year. We've had 1 or 2 go outside of that where insurance kicks in, but in general, this is free to all of our students based on their needs. University Hospitals also supported a UH NEOMED Student Scholars Program, where 6 to 10 Ph.D. students per year who are high achievers will receive additional funding beyond their normal stipend for an additional $5,000, bringing their stipends up above what most individual organizations pay in this state for Ph.D. students. We created new professional development resources, expanded food service, variety, and hours, and we had strategic initiative funding available for all of you to decide how can we work together and let you spend money that helps to achieve the university's goals in our strategic plan. We increased employee benefits. Mary Taylor's worked to get new benefits in that we didn't have before, such as pet insurance, if that's something that you wanted. And the NEOMED Healthcare Facility was made so that you can access it while you're here at work without having to take time off. And we arranged that you would not have copay. And we did that through our insurance provider so that anybody insured at the university has no copay if they choose to use our healthcare platform for their healthcare. We set aside over $2 million in strategic initiative funding, meaning funds that you could come forward and say, I've got an idea for where we should spend money to improve this university around our strategic plan. Ultimately, $1.5 million of that has been spent. The vast majority of it is on academic administration and people, but you can see that the research element benefited greatly with over $340,000 in spend that was determined by our faculty of how they wanted those dollars to be utilized. We also focused heavily on our academics. We have 4 colleges now. 50 years ago, we were one medical college. We served multiple universities. Now we are one university with 4 colleges of our own. These are the things that's taken place. Every one of them has a new dean, transformed or new curriculum in each. Class size expansion in the College of Medicine and in the College of Graduate Studies, where they now have 9 accredited master's degrees. 5 of those are new. They revamped the Ph.D. program. Enrollment is up over 300% in the College of Graduate Studies. And yes, it says the top performing college. The reason we say that is our ultimate metric is, did we get the students from A to Z, meaning the time they joined us to graduation, on time? If it's on time, that means they passed their classes, they passed any national certifying examinations, we were able to give them the health and wellness resources they needed to thrive. And most programs in graduate studies have a 95 to 99% on-time completion rate. To get an understanding of how we're viewed by the public, one of the things we look at is the types of students who come here. While every one of our students are always amazing, if you look at the College of Medicine, our average MCAT went from 506 to last year, 514, this year about 513, so right about on par. And we've had a substantial increase in the number of people applying to come here because this has become a much more attractive place for people to come. Outstanding performance in the College of Pharmacy with NAPLEX rates, graduation rates, and jurisprudence examination rates that exceed those of the national average. And of course, the Batante College of Dentistry has just started. We were able to raise over $20 million to get that off the ground. Hired faculty, staff, got through initial accreditation, and we are doing well. We've actually done much more than that with our academics. For those of you who were in 2019, you probably remember we had a really low budget, off-the-shelf learning management system. Instead, we've replaced that with Canvas, which is the state-of-the-art program that are being used by most universities. We've added Interfolio. We have more student resources. We've invested in the facility upgrades that I've mentioned and modernized our student assessment system. And we have now invested into a scheduling system for our academic space. We completed an academic space review. Until you know what you're actually using, you don't really understand what it is you need. We heard a lot of concerns that we didn't have enough academic space to teach our courses. So we used the Lean Six Sigma team to do a complete teardown. And what we found was we're using only about 30% of our total capacity. Some rooms were being used as little as 5 to 10 times per year. Others were getting about 90% utilization, but we were not anywhere near capacity. And part of that is just the culture of academia but we don't want to have classes on a Friday and on a Monday. Well, this is where our space is. It's really expensive to build new space. So we worked on a culture change where people understood that we do have the resources, we just sometimes have to adapt to the way we operate. We have invested in state-of-the-art technology in all of our classrooms. Certain areas in conference services are now undergoing those revamps so that the whole campus is there. We've hired a provost whose job it is to ensure academic quality and to work to coordinate our colleges together, which allows the rest of us on the campus to focus on business operations, growth opportunities, and external relationships. Our educational quality is going up dramatically, and while many had fear of SB1, the fact that there's an annual performance review that also looks at teaching quality, granted there are many ways to measure that, does give us feedback so we can work with faculty to say we need to get you more resources. When you go to graduate school, they usually don't teach you to teach. And so it is incumbent upon us to make sure that people have the resources they need to do just that. We've enhanced our data infrastructure, and we're investing in student outcomes. The Wasson Center is now really a picture of health. Our lean operations teams worked with the Wasson team, who embraced change, and we went from an organization that was really operationally not very efficient and spending a lot of money and resources to one that's delivering improved quality and is doing it in a sustainable manner. In fact, they're really a poster child for us in the way we're looking at revamping programs across this region. These are some legislators on the left who are using our Wasson Center to understand what it is we do. We have an advanced anesthesia simulation center that's been built out at this university, and our free clinic has really been a standout. 4 times now we've received the National Gold certification, and that's only about 10% of organizations that get this. And the National Association of Free Clinics has recognized what we're doing, and we've also been recognized as the #1 free clinic in the state of Ohio. The College of Medicine worked on how they could create sustainability and modernize what's taking place for student experiences across the country as things have gone away from grades and scores to how do you differentiate a student's quality. And they worked with the advancement team, brought in a large amount of money to support this program, and now we have a badging system that allows students to meet a high bar to graduate with the badging that says they're focused on research and scholarship, or perhaps they're focused on advocacy, key elements in creating transformational leaders. I told you that in 2019 we received some tough news from LCME. but we've got a great team of people. And since that time, we have not missed the mark. 2020, we received full accreditation with LCME, and since then, all 8 of our accreditation pursuits have been glowing, actually glowing. Higher Learning Commission came and gave us a full 10 years. So we are doing great things, and we are doing it the way we're supposed to, and our accreditation bodies are recognizing that for us. We started up executive education. The intent of this was to meet the educational needs of our clinical partners, those faculty, mostly physicians, pharmacists, some nurses, who wanted to learn about Lean Six Sigma in healthcare, or FAME, which is the Fellowship in Academic Medicine in Education, ACGME education, or in research. We've also got the FIRE program for innovation and entrepreneurship, and a health and wellness coaching program. 2 of these have national certifications behind them. So if you look at NEOMED's enrollment, and really it's since 2020, since 2018 and 2020 are identical, we've grown 26% to today just in our credit-bearing programming. When you bring in our exec ed program, which has been thriving, we've actually grown 96%. So at a time when you hear higher education is contracting, colleges are shutting down, our enrollment is going up because we provide real value to the students that we are attracting. Discovery is a key part of our mission at this university. We hired a new vice president for research, restructured our research infrastructure so that we now have institutes that span across the campus and sometimes span partnerships, in addition to supporting our research-focused areas. We've created President's Excellence Awards in Research, also to recognize outstanding researchers at this institution, and we've committed to a 2x increase in funding for student research. Been working with Dr. German to do just that, and this year in the budget, we have doubled it compared to where we have been. As I said, RGE4 is a state-of-the-art institution that's now been opened up. And with our faculty, we allotted about $350,000 in funds for them to expend to be able to improve research, whether it's maintaining a microscope or it's investing in infrastructure within laboratories. It's a way for us to support the needs of our researchers on this campus. We've also connected outside the university and created additional resources, recognizing scholarship is sometimes not only research, but it can be research and development. It can also be quality improvement products that are recognized by ACGME and our clinical partners. We built out the ability to do medical device development in partnership with the Ready Zone. We've created the Timken Medic and received $1.7 million in funding by the Timken Foundation to do that. We've created the Clinical and Translational Research Institute, led by Dr. Phil Turk, a world's expert in artificial intelligence and in biostatistics, to build out an amazing program that's allowing us to thrive into the future, applying that to basic research, translational research, and into commercialization work. We've become part of the Midwest Pediatric Medical Device Consortium, and we are added on as a key partner in the Northern Ohio Clinical and Translational Science Consortium, a $56 million NIH-funded organization that's headquartered out of Case Western Reserve, but we are on the leadership team for this, and we have about 8 faculty and staff who are receiving financial support from that organization, and we have invested in increasing the number of Ph.D. students the university funds. We've got joint research partnerships with Akron Children's Hospitals, including Dr. Ball and Dr. Cease, who are here at this university, both of whom are doing stellar work. CTRI is now partnering with many of our clinical partners to deliver their resources to them, and it's a recharge so that they're supporting us to be able to keep it going. We've just received board approval to invest $5.6 million into our ailing chillers, and this is under research because they're key to maintaining our comparative medical facility. We've enhanced RFA support dollars through Dr. German's budget efforts, and we are expanding our Student Research Day. I think this is a really unique opportunity here. The Journal of Medical Sciences at NEOMED was the brainchild of one of our students. It has now received an endowment from a donor, and it gives our students the ability to run a journal. It's peer-reviewed. It's an opportunity for students to become editorial experts, peer reviewers, and to publish their work. Vitals was our way of getting out that we are indeed about leadership. And so Vitals is value, innovation, technology, advocacy, leadership, and service. The core principles today's leaders are using to transform healthcare in the United States. And we are building a brand around this. University hospitals loved this and wanted to be part of it. And so they are actually underwriting our ability to deliver this. So it doesn't cost the university anything to bring in these world-class speakers. And now the American Medical Association EdHub, where 600,000 plus physicians go for their free CME every year, has NEOMED as one of the very few institutions in the United States to target leadership in medicine. And it's led to a dramatic impact in the number of people who are accessing Vitals, learning from Vitals, and building out who and what we are. The Ideator event was a chance for NEOMED, university hospitals in the community to come together to solve some of our biggest problems in healthcare. And we are at year 4 of that coming up. UH has invested dollars into supporting whoever wins this event, usually the first 2, to move forward with their ideas to measure what impact they're actually having. And of course, during the last 5 years, we became a Project ECHO Super Hub, one of 14 global super hubs that allow us to really work to disseminate education across the United States to improve healthcare delivery. And this year, the Exec Ed program under the leadership of Jordan Sindrich saw a vision for us being the culminator of healthcare performance and operations here in Northeast Ohio, and held the Northeast Ohio Healthcare Transformation Forum. We had 140 healthcare leaders on our campus this year, engaging in how we can work together, how we can improve access to care, how can we improve quality of care. And it also became a big focal item for our Lean Six Sigma programming that's led to an increased rise in those looking to get their education here from NEOMED. All of this just builds our brand and who we are. University Hospitals has invested very heavily into us. From a research standpoint, we now have the UH NEOMED Neurodegenerative Disease Research Center, led by Dr. Fleming on our side, Dr. Sheikh and others on the UH side. The University Hospitals NEOMED Hearing Research Center, led by Dr. Rosen here, and multiple individuals on the UH side. C-Tree NEOMED Artificial Intelligence Healthcare Program, again led by Dr. Turk on our side, with a massive expansion that's about to occur, and leading them to build out a team on the UH side to really make this a defining moment in time as to who and what we are in research. Center for Maternal and Infant Health, UH NEOMED faculty scholars, UH NEOMED student scholars, and they've invested over $5 million to date into NEOMED to grow and to run these programs. We also started up NEOMED Healthcare. We now see over 7,000 patient visits a year. We're an integrated primary care and behavioral health platform that heavily serves our community, but also provides care to our faculty, our staff, and to our students. Kunal Amin started Neovations Pharmacy Consulting, which does all of our vaccines here for our students on our campus, but they're a medication therapy management program that follows CMS, Center for Medicare and Medicaid Services, standards, and we are serving thousands of patients per year at our partner hospitals to improve the quality of care. And Outcomes is the U.S. News and World Report for medication therapy management, ranked NEOMED #1 in the nation, comparing us to all major hospital systems that do this. So that is a real button in our shirt to show that we are doing amazing work. NEOMED Dental Care will launch in 2026, and we sold Roots Down Pharmacy that lost $2 million and was consecutively losing several hundred thousand a year to Summa Healthcare, so it's still here. It still does what it was doing before, but instead of costing NEOMED money, we were able to put those resources back to the work that you're doing, and Summa helps by paying a lease on the space in that building that we built. We have a focus on innovation and entrepreneurship. Kinetic is a joint venture between us and Bounce Innovation Hub. Bounce Innovation Hub is a 300,000 square foot business incubator that is in Akron. They have done amazing work. About half of it is focused on healthcare. And so we are now formally joint ventured with them. They're bringing teams in to use our resources, the Ready Zone, the Timken Center. So we are here to support workforce development and improve healthcare through new technologies being commercialized into the market. We've had a dedicated focus on our clinical partners. 2019, Dr. Basson wasn't here, but if he were, he'd say, I'm a little nervous. We have 160 students coming into medical school, but we got about 140 clinical spots. And I think a big piece of that was we were not the ideal partners we could have been. We have since changed that, and now we have the ability to have over 200 spots for our clinical rotations. That's happened because of relationship building, meeting frequently, looking to see how we can help them because they always help us. And now they're supporting not just medicine and pharmacy, but our anesthesia assistant residents and our dental programs, and will soon support the certified mental health assistant program. The Cleveland Clinic, while we don't have joint strategic oversight group meetings with them, I do meet with their leadership, typically bi-monthly. We've worked on expansion. We are now in Akron General. We're also in Mercy with our CAA program, and they've opened the doors to Fairview Hospital for us in Cleveland. The Veterans Administration has increased the number of spots for us in Cleveland, but because of the work we have been doing, the VA from Columbus reached out and said, we want your students here. So now we have students that rotate in Columbus in family medicine, they have psychiatry, in addition to the work that we've been doing with Mount Carmel in Columbus. And we've been building our research and military training partnerships. I think many of you know that we now have partnerships with all of the service academies. Although the Air Force hasn't performed the way we'd like yet, Dr. Fazen's working on that. I hear about it every day. But the Navy and the Army have stepped forward, and we have some academy cadets who have joined our College of Medicine class this year. And we have about 9 who are coming to visit with us and have a special interview day on November 10th, the day before Veterans Day this year. University Hospitals has really been the model new affiliation agreement. Our leadership team meets every 2 weeks for an hour, a dedicated meeting on what we're doing together, what we can do better together, approving funding for the programs that we're doing with them, looking at executive education and how they better can utilize our programs, and expanding the number of clinical rotations that NEOMED has at those institutions. This really is a model, and we'd like to roll this same model out to all of our clinical partners. We've just started this process now with a couple of them. One of our biggest partners is our legislature. You probably know we get about 25% of our funding from the state of Ohio, in addition to additional funds that we can request periodically. So our government affairs team put together Doctor for a Day. This was a bit of a brainchild from Dr. Basson. The concept was bring them down and take them all the way from admission to medical school and a white coat ceremony to the anatomy lab and research and clinical training to matching and then getting a residency. So they learn what it is we do at this institution. And it has been incredibly well received. This is one of our graduating classes. Those in the white coat are all senators and representatives in Ohio. They also helped us create the new Certified Mental Health Assistant Program. Senator Gavarone and Senator Serino partnered with us. Senator Gavarone was the champion, and now we have a new law where NEOMED is going to be the first in the nation to create this brand new healthcare worker. And they also helped us receive $5 million from the state for our College of Dentistry to start up, $1 million to contribute to that $5.6 million chiller project to support our research facilities. And the federal government, at that time it was Senator Brown, put us in for $2 million for the College of Dentistry. So it's important that we pay attention to our legislators because we are a tool for them. They want workforce development. They want as Governor DeWine likes to say, wants every Ohioan to be safe, to be healthy, and to meet their God-given potential. And we are a tool for them to be able to do that by creating these opportunities for workforce and opportunities for Ohioans to come here and to thrive. 72% of our current students who came in this year are from Ohio. 81% of the College of Medicine are Ohio residents in the first-year class. We've also developed partnerships with Senders Pediatrics, the Cleveland Browns. We've created a new partnership with Miami University, signed 2 agreements, and big things are coming with them. We partnered with Southwoods, who also supports our free clinic for us. And Kent State University, you know we've worked with them as a partner for many years, but they've just created a brand new 6-year degree program where 2 years will be spent at Case and 4 with us for creating pharmacists for the area. I mentioned the United States Air Force Academies, and Air Force Academy, Navy, and of course, West Point. But we just signed a 20-year major affiliation agreement with the Christ Hospital in Cincinnati. It is the number 5th ranked hospital in Ohio, number 1 ranked hospital in the Cincinnati region, and they reached out and said, we want to partner with you. So there are many more things coming with them as we build this out, but we do have a fully signed agreement that was approved by our Board of Trustees. So where are we financially? We've had a lot of effort on being more efficient and effective with our resources so that you have more resources to do the work that you do. Lean Six Sigma was adopted. We created the Office of Strategy and Transformation and gave it a home there. We've created employee empowerment resources. Financial sustainability has yielded from that. Zero-based budgeting, I realized, was a really tough one for everybody to learn about, but it's gotten us exactly where we need to be. It's allowed us to eliminate waste, to be smart about our dollars, and to grow only in areas that make sense to us, not to spend money on things that are not part of our mission. And then, of course, we focus on risk mitigation. So I told you we were in the red. We were in -1. And then we were mostly in the yellow at 1. Now, there's a little pandemic fluctuation, but we are now a true standout, and this is 2024 data, where we climbed to a 7 out of a range of -4 to 10, and we will get this past year's numbers soon, and I'm confident they're going to be above 7. This is a reflection of how much money the university has in our reserves, which protects us from fluctuations. It also measures our debt, it measures our cash flows, and it measures our potential for growth. The other outside agency that looks at us is the bond rating agency, and they are very tough. As they told us in our last call a few weeks ago, you can stair-step up, but it's an escalator ride down if you look like you're having any financial difficulties. And they've given higher education in the United States a negative outlook, meaning it's not a good industry to be in. Some time ago, before 2018, some things happened at this university that dropped our bond rating to Baa2. Below this is Baa3, then it's junk bond rating below that. What we've done here is a progressive increase. So we've got Baa2, positive outlook. Then they gave us an upgrade to Baa1 and said we were stable. And then they moved us to Baa positive. And so this year, we certainly deserve going up to A, and we're hoping we will, but we won't know for several weeks. We met with the bond group, and they're going to go hash it out at their board meeting. Really, our last report card, when they gave us positive, the report card said we should have been at least an A. They just didn't move that quickly. And this is a reflection of, do they think we are on sustainable growth trajectory? Here's what enrollment projections are. So I told you we were at 930 in 2020. This year, we're at 1172 for our credit-bearing programs, a total of 1822. But we are on a trajectory to go to over 3,000 by 2029. Yes, about 900 of that is executive education. The rest of it is our traditional credit-bearing programs. If you think about it, we just brought in 52 demo students. We have 3 more classes of that to add on. That's more than 150. The CMHA program is a year plus program that's projected to start at about 109. So that's more than 200 additional students. College of Graduate Studies is growing, and College of Medicine, because of all the program support we get, is able to grow a bit too to help support physician development for the state of Ohio. We used to be unranked in almost every single area before 2020. And in fact, we were an unranked institution with U.S. News and World Report. Why? The shrug I got in 2019 was, because we don't think it's going to rank very well. It's better not to have anybody see where we're at. We pushed that aside. We've leveraged national and local marketing chains, and we were in the 50th to 60th percentile, which is not bad out of 193 medical schools. This is the medical schools that are getting ranked here. 193 of them, including competition against Ohio States and Michigans and Yales and Harvards and Stanfords and UCLAs out there. So this was a good place for us to start out. We also were given, for the first time ever, a U.S. News and World Report ranking of best graduate school in 23 and 24. We didn't get 25 because they discontinued this program. Otherwise, I'm sure we would have received it. I told you about the 4 gold rankings that we received from the National Association of Free Clinics, the #1 ranking in the nation by outcomes. 12 of NEOMED's faculty were recognized in the top 2% of researchers worldwide by Stanford and Elsevier on their last report. And Scott Becker, who runs Becker's Healthcare, a nationally recognized program, came out not too long ago on a podcast and said, quote, "What NEOMED is one of the great medical schools in the country." And of course, we know we are much more than a medical school, but it is a key piece of our identity and who we are. So this is what we achieved in our strategic plan. Nearly 100% completion of everything we set out to do. And it's not me doing that work, it's you doing that work. So thank you all for allowing us to achieve what we've accomplished. We did kill the plan a little early because it was time to refresh it before September hit. And so we've now created our 2030 strategic plan, which builds upon everything we've done and learns from the lessons that we've gained during the first 5 years. So we skinnied the mission down. It's still the same mission, but it's much easier to memorize. It's clean, it's crisp. NEOMED creates transformational leaders and improves health. We improve health through research. We improve health through products of education who go out and take care of all of us. We create transformational leaders who do wonderful things, and you can see our graduates who are skyrocketing across this country into leadership positions, changing healthcare through their research, changing healthcare through their leadership in businesses, but it's also our faculty and our staff who are doing incredible things. The work that Hans Thewissen is leading and Moses Oyewomi is leading in their departments, the NIH, the DoD grants, the funding we receive because of the quality of the work that is coming out of here. Our vision is to forge the future in innovative healthcare education and research excellence. And I firmly believe we are doing just that. You never achieve your vision, you constantly strive for it. And in the past, our values were a little long. They spelled out leaders, but the problem was nobody really knew what that meant. When you ask, if you can't remember what your core values are, they're obviously not that valuable. So we brought them down to integrity, meaning everything we do with integrity. We do what's right even when nobody is looking. We do it through collaboration because you can't be as successful in a silo as you can by working in teams. If you looked at HLC accreditation, it involved the provost office, it involved the strategy office, it involved the legal office, it involved all of the deans, it involved all the curriculum committee people, it involved all of the student services group. This was a team effort, and everything we do here is a team effort. And everything we do should be in the pursuit of excellence. If we are not trying to be the very best we can be in every program we have, then we shouldn't be doing it. Somebody else should be. We've dropped from 6 pillars, or what was originally 5 pillars in a strategic beam or structural beam, to 6 pillars, to just bring it down to 3. We do academics, empowering future healthcare leaders. That's focused on our students. Discovery, advancing research, innovation, and entrepreneurship. That's our faculty and our students. And then engagement in operations, building a culture of transformational excellence. I see the top two as our mission, our main mission, and the bottom is mission support. We've got to give you what you need to be successful in research and in academics. Now, we do have risks. We've done a great job at mitigating those risks, but they're always out there. About 25% of our funding comes from the state of Ohio. And every 2 years, we see that funding dropping. And there's reason for it. Money's tight. It's dependent on taxes, and there's a balance between paying taxes and giving money out to support state institutions. And while we did get a 1% raise this year, inflation went up over 3%, so really we're not holding our own. So we're constantly working to ensure state support is there. The governor's office, the Senate, and the House did what they could do to help us out at a time when taxes were cut. We have increased insurance rates. It's a constant problem. We use our health care. We spend more on health care than we pay our insurance company again this year. So we know we're going to get another increase to the cost of our health insurance. Right now, we're being told our health insurance likely is going to go up 30% compared to where we currently are. Now, you need to use your healthcare resources because you need them, but at the same time, if there are ways to tailor that down to benefit each other, I encourage you to do so. Instead of waiting to go to an emergency department at 7 at night, try and go in to see your doctor at 2 p.m. We have some here that are available for you. ER care costs a lot more than going to your primary care doctor. Medications, use generics when you can. So we need to be good citizens with each other, but we are expecting healthcare is going to go up. We've already been told probably about 30%, maybe more this year. We're watching federal funding very carefully. Indirect rates on NIH, DoD grants, NSF grants. The direct grant awards may have reductions. We know there have been holdbacks. There are restrictions that have been put in place for federal student loans. So a professional loan, like going to medical school or dental school or pharmacy school, has been capped at $200,000 in total. I don't know of a medical school or dental school in the nation where you can go through all 4 years and only borrow $200,000 because it's not just tuition and fees, it's living expenses for the students. So we expected we were going to see a little bit of a drop in out-of-state applicants to this university, and we're already seeing that. But fortunately, we've been between 81 and 85% in state, so we still have more than we need. We're still in a good spot, but we keep an eye on this. We have constant competition for our clinical training spots. Cliff Devaney told me they get offers from some of the Caribbean medical schools to bring them in, and which means displacing NEOMED, offering them $20,000 per student, which is something we really can't touch with the amount of funding we have without significantly increasing tuition, which we don't want to do. So instead, we create value by being very good partners with them, offering them services and resources. Of course, we look at economic conditions always, and then we receive unfunded mandates. SB1, right? We need to spend time tracking, making changes, but there's no money to do that. And it's not just SB1. These happen with Title IX, and these happen with Department of Higher Education. We get them all the time. We want them to do more, but they don't take away what we are already doing. So we have to be more efficient with what we do and the resources that we have. So our Vision 2030 is statewide collaboratives, building strong connections to improve health in Ohio, having a robust financial health of this university, stewarding our future, strength and sustainability, campus beautification and smart growth so that we are investing in our infrastructure, commitment to discovery and innovation, and that will be our biggest new increase over the next 2 to 3 years, will be our support for discovery research at this institution. I think our academics are in a really good place right now. Leveraging data sciences to modernize and transform health, using AI and other data tools for business operations, for research operations, and for education and academics, and then getting everybody out in the world to see the great work that all of you are doing, amplifying our brand, getting that prestige that you deserve. Your programs are thriving. We are a model university right now at a time when the others across the country and certainly in this state have significant reductions in shortfalls in finances, some of them 40+ million a year shortfalls that they've got to make up for, enrollment dropping, people not seeing the value in what they're doing. But what you're doing is absolutely thriving. Here's our footprint right now in Ohio. Yes, the big flag is in Rootstown, but if you look at this, we are now in Cincinnati, Dayton, Columbus, Cleveland, Akron, Canton, and Youngstown. We are truly Ohio's health and sciences university. We are not focused in one spot of the state. And it is because of all the opportunities coming to us because people are seeing our value. That's a reflection of the great work that each and all of you are doing. The other resources that we hope to continue to give you, summer wellness, and of course, don't have the dates picked this year, but we will give everybody additional vacation days around the holiday break coming up in December. So I'm really thrilled with where we're at. I'm really so pleased with all the incredible work that all of you talented individuals have put forward to make NEOMED the place that it is today. And 5 years from now, I think we're going to be even so much more. We're thrilled to have you as part of this team. We hope that you feel an important part of this team and that you will stay with us and continue to grow over the next 5 years. With that, I want to thank you for your time today.